All right, behind me here is a concept I think a lot of people kind of misunderstand and don't get. So we're going to drill down each of these pathways so that you guys understand this. So you can have a brain bleed, an intracranial hemorrhage, and then some people use the word stroke. And I want to make sure we understand the difference of a traumatic brain injury versus a medical reason to have an intracranial hemorrhage. So can someone think of a medical reason, and we'll talk about the two most common here, for why someone would have an intracranial brain bleed from a medical reason. Okay, so one of them is hypertension, or accelerated hypertension as I would say, and the other is going to be an aneurysmal bleed. Okay, so this is a patient who is just carrying on with their lives, having a normal day. They have uncontrolled hypertension, and all of a sudden they have, quote, the worst headache of their lives, and then maybe they syncopize or collapse. And these patients a lot of times get brought in as trauma alerts because they meet trauma criteria, and then we find out on the CT scan that it looks much more like an intracranial hemorrhage from a primary medical event or cause. So they had an underlying aneurysm or AVM, arteriovenous malformation, that then bled, okay? This is dramatically different than a patient who has a traumatic injury and develops different types of TBI, or traumatic brain injuries. And so a lot of you guys know these, so give me some examples. So an epidural hematoma, a subdural hematoma, a subarachnoid hemorrhage, which is what most of these typically end up becoming, or they can become interventricular hemorrhages like Lennox had. But again, these are more in the trauma realm, okay? Whereas a hypertensive bleed typically happens in the basal ganglia, or an aneurysmal bleed or AVM that are medical. And people may say, oh, well, they fell. And the whole chicken or the egg thing is into play here because it's the stroke or the brain bleed that caused them to syncopize and collapse. They had the worst headache of their life. Whereas this, they were actually in a traumatic accident that caused the bleed. So keep those two things very much different in your mind.